Said about 3.5 months that her stomach was more round than a normal baby's stomach. So we went to the hospital and got an x-ray along with a sonogram and found a 2 inch by 2 inch by 2 inch tumor. Instantly just started bawling. It hurts. Like she's so innocent and she was only 4 months old when we found out. We went to see Dr. Kaylani. He knew that this was going to be successful with chemo treatments and a treatment plan even after chemo.
It was a blow to us, so our life changed in a matter of just 2 seconds of a phone call. Well, this past year, he has still been in pretty intense treatment. And actually, this is our first week that we have not had a doctor's appointment. He is technically in remission. I know he looks a little sad right now, but he usually is. If you would look at him, you would never be able to tell that this is all going on.
Transfer of care can be very, very cumbersome, moving the entire family to a different city. And that's not possible. I mean, it's financially not possible. You don't get the kind of emotional support from the community when you move to a different city.
And so what happens here is we are offering them a medical home as part of Texas Tech and Northwest, where they can get all their care in one place.
The treatment for a child with pediatric cancer requires different types of therapy. There are certain chemotherapies where they need to be admitted to a hospital or they need additional supportive care, for which we use the Northwest Texas facility.
Life doesn't stop just because your child is diagnosed with this diagnosis. So what we're trying to offer these families is an easy way where we take care of their child while they can keep their lives as normal as possible. It will not be normal, but we're trying to make it easier for the families.
Both doctors here have been, oh my gosh, so patient with us, and with Becky, like the child life specialist at Northwest. She's been amazing. Both my kids adore her. They can be in the worst of moods and they hear her voice and they perk up.
Dr. Kaylani's bedside manner was absolutely amazing. And then when we got to Northwest Texas Hospital, we have had amazing nurses. Brooke is always making sure that we're on track and right where we need to be.
We are in a small city of Amarillo, but we can provide the patients the exact care or very similar care that can be provided in any bigger city.
The same therapy that they're going to be getting in New York, in California, in Europe.
And that happens because of this joint collaboration, not only this joint collaboration, but also through our collaboration with the Children's Oncology Group.
The closest we could have gone was Oklahoma City, and that's still 3 hours away. And, when you go far away, you don't have the supportive family.
It's been such a blessing to be able just to stay in town and not have to travel.
I did not know that there was the exceptional care that is given here in Amarillo. And we're just so grateful that there is. I noticed at about 3.
Hello, I'm Kai Arsenal, an MSDI student in my second semester of the program. Thus far, we have been educated in numerous topics. Pediatric medical nutrition therapy was a topic we had not touched upon during my undergraduate school. I was disappointed, as my aim is to be a pediatric dietitian. In my future endeavors as a registered dietitian. However, in graduate level courses, we are able to be exposed to this topic. There is a course on pediatric medical nutrition therapy in which I have enrolled in as an elective for my next semester. Until then, I have what I've learned thus far. Moreover, I want to focus on oncology classes as a dietitian. Cases as a dietitian. My dream job is to be a pediatric oncology dietitian at the Children's Hospital of San Diego. Cancer is a topic that has been brought up numerous times throughout undergraduate and graduate school at MSU. As you saw in the video, pediatric cancer is a life-changing affliction for not only patients but families to deal with. The lives of these children are drastically different from that of one who leads a healthy and safe upbringing. The way the medical staff comes together to support these children and their parents is essential for not only the patient's well-being, but also the mental and physical health of their parental guardians. Although a dietitian is not mentioned in the video, we play an enormous role in the lives of these children, as well as their parents. As many children are too young to grasp the importance of proper nutrition, it is our responsibility to educate their parental guardians for the child's dietary needs. There is much misinformation out there upon foods to be avoided, as well as foods that supposedly fight and cure cancer. We as dietitians have the opportunity to rectify these preconceived notions upon appropriate diets for pediatric oncology cases. In this video, I will be summarizing the importance of MNT in pediatric oncology. Childhood is a critical time for proper nutrition habits to be established. Without adequate nourishment, growth and development may be delayed. Long-term effects have the potential to form later in life. During cancer treatment, nutrition is often overlooked. The battle against cancer often foreshadows the importance of maintaining proper nutrition. During adolescence, proper nourishment is essential to support a growing and developing body. Different forms of treatment impact not only this, but their ability to fight off infection, as well as combat the disease. Malnourishment comes in many forms and of varying levels for these children, typically in relation to the type of treatment as well as diagnosis. For instance, treatment for pediatric leukemia often involves the usage of steroids to fight graft versus host disease. GVHD post-stem cell transplant is when the tissue of the donor begins to function in the body by producing new blood cells. But the host's immune cells do not recognize these new blood cells and begins to fight the entire body as a new blood cells circulate through it. As a result of steroid treatment, it is a common side effect for children to present with the obesity during treatment. Elevated visceral fat may cause changes in treatment methods as well. Chemotherapy dosages have been calculated based on body composition, leading to higher doses in children with BMIs greater than 85th percentile. Unfortunately, much of this improper nourishment is related to a lack of nutrition education. There was a study conducted on children in treatment focusing on their nutritional intake. This study produced findings such as acceptable quantities but poor qualities of food consumed. This study was only an example of many reasons for different body compositions for those undergoing pediatric oncology treatment. However, rates of development vary from child to child, with an unfathomable number of components impacting their body composition at any given time during their lives.